Hello and welcome. Today we'll be discussing primary biliary cholangitis, or PBC. This is a chronic liver disease that, while relatively rare, can significantly impact a person's quality of life. Join us as we delve into the causes, symptoms, and management of this condition. While the exact cause of PBC remains unknown, it's widely believed to be an autoimmune disease. This means that the body's immune system mistakenly attacks its own cells. In the case of PBC, the immune system targets the small bile ducts within the liver. Genetic predisposition is thought to play a role, as PBC is more common in people with a family history of the disease or other autoimmune conditions. Environmental factors may also contribute to the development of PBC, but these are not yet fully understood. In PBC, the immune system attacks the small bile ducts in the liver. These ducts are responsible for carrying bile, a fluid that helps digest fats and eliminate waste products away from the liver. The chronic inflammation damages and eventually destroys these ducts. As bile flow becomes obstructed, it builds up in the liver, leading to further inflammation and damage to liver cells. Over time, this can result in scarring of the liver tissue, a condition known as cirrhosis. Cirrhosis impairs the liver's ability to function properly, leading to various complications. PBC affects mostly women between the ages of 30 and 60. It is estimated that about 1,000 women over the age of 40 have PBC. While it can occur in men, it is much less common. The prevalence of PBC varies across different geographical regions, with higher rates observed in Northern Europe and North America. However, improved diagnostic methods are likely contributing to the increasing recognition of the disease worldwide. The early stages of PBC are often asymptomatic, meaning that many people have the disease for years without knowing it. When symptoms do appear, they can be vague and non-specific. The most common initial symptom is fatigue, which can range from mild to debilitating. Another common symptom is pruritus, or itching, which can be particularly bothersome. As the disease progresses, other symptoms may develop, including jaundice, or yellowing of the skin and eyes, dry eyes and mouth, darkening of the skin, swelling in the legs and ankles, and pain in the upper right abdomen. Advanced PBC can lead to complications such as osteoporosis, liver failure, and an increased risk of liver cancer. Diagnosing PBC typically involves a combination of blood tests and imaging studies. Blood tests can reveal elevated levels of liver enzymes, indicating liver damage. A key diagnostic marker is the presence of antimitochondrial antibodies, or AMAs, in the blood. These antibodies are found in the majority of people with PBC. Imaging studies, such as ultrasound MRI or CT scans, can help to visualize the liver and bile ducts and rule out other conditions. In some cases, a liver biopsy may be necessary to confirm the diagnosis and assess the severity of the liver damage. While there are no distinct types of PBC in the same way some diseases have subtypes, the disease is often classified based on its stage of progression. The stages are typically determined by liver biopsy and can range from mild inflammation to advanced cirrhosis. This staging helps doctors understand the extent of liver damage and guide treatment decisions. Currently, there is no cure for PBC, but treatment focuses on slowing the progression of the disease and managing symptoms. The primary medication used to treat PBC is ursodeoxycholic acid, or UDCA. UDCA helps to improve bile flow and protect liver cells from damage. It has been shown to slow the progression of PBC and improve long-term outcomes. For those who do not respond adequately to UDCA, obeticholic acid, or OCA, may be prescribed, though it can have side effects that need to be carefully monitored. Other medications may be used to manage specific symptoms, such as antihistamines for itching and artificial tears for dry eyes. In advanced cases of PBC, a liver transplant may be necessary. Lifestyle modifications such as avoiding alcohol, maintaining a healthy weight, and getting vaccinated against hepatitis A and B are also important for managing PBC. As PBC is an autoimmune disease with an unknown cause, there are currently no known ways to prevent it. However, adopting a healthy lifestyle, including avoiding excessive alcohol consumption and maintaining a healthy weight, can help to protect the liver and reduce the risk of complications. The prognosis for people with PBC varies depending on the stage of the disease at diagnosis and their response to treatment. With early diagnosis and treatment with UDCA, many people with PBC can live for many years with a good quality of life. However, if the disease progresses to cirrhosis, complications such as liver failure, portal hypertension, and liver cancer can develop, which can significantly impact prognosis. Recent research is focused on identifying new therapeutic targets and developing more effective treatments for PBC. Studies are also underway to investigate the role of genetics and environmental factors in the development of the disease. Ongoing clinical trials are exploring new medications and treatment strategies that hold promise for improving outcomes for people with PBC.